there are 6 supplements that I absolutely love for not only calming down PCOS, but in a lot of times reversing it, so that you get rid of that risk of diabetes and fatty liver and sleep apnea, and you are able to get pregnant again. You have return of your cycles and your fertility improves. So if I had PCOS, these are the 6 supplements that I would definitely be doing. Number 1, myo-inositol and D-chiro-inositol. So these have been studied with great results. Inositol's shown to reduce insulin resistance and elevated testosterone levels. So when they combine it with folate, they showed improved pregnancy rates and egg quality, which looks like better AMH levels. So there was a study in the Gynecology Endocrinology Journal that actually showed that it prevented gestational diabetes in some women as well. So it looked at women with PCOS who became pregnant. They had one group who took myo-inositol and one group who did not take it. And the women on myo-inositol developed gestational diabetes 17.4% of the time, whereas the control group developed gestational diabetes 54% of the time. That's huge. That's a big difference. And gestational diabetes not only affects you as a pregnant woman and increases your risk of type 2 diabetes later in life, but having gestational diabetes increases your baby's risk of being an obese child and having diabetes themselves. So if you do not want to set your brand new baby up for, all of those issues, it's imperative that you don't get gestational diabetes when you're pregnant. So I like using a combination of myo-inositol and D-chiro-inositol. My favorite is Sensitol from Designs for Health. You want to get at least 2 to 4 grams of that per day for great effects. Berberine is another amazing one. It's extracted from golden seal. It's well known for its ability to improve blood sugar balance and cholesterol, but it's just as effective for insulin resistance and hormone imbalance in PCOS. So studies have shown that taking 400 milligrams 3 times a day causes significant improvement in your menstrual cycle regularity, ovulation, and insulin resistance. So it is important to know that berberine can alter the clearance of certain medications in your liver. So talk to your doctor if you're on medications like antidepressants, blood thinners, or beta blockers, because berberine might decrease those levels. And I'll just make a side note, like, I am not your physician, right? Even though I am a physician, I'm not giving you specific medical advice for you. I don't know you as my patient. So these are just general recommendations for women who struggle with PCOS. And if you do want to work one-on-one with me, that is a possibility. But just know that you should always talk about these things with your doctor or provider and base it off what's best for you as an individual. So back to my general recommendations. Number 3 is omega-3 fatty acids. So these are a necessity when it comes to PCOS, because PCOS causes inflammation in the ovaries. This prevents the mitochondria from doing their job. Omega-3s are anti-inflammatory, so they counteract the inflammatory process that is destroying your egg quality and the ovary's ability to ovulate and make progesterone. Omega-3s also help regulate insulin and leptin levels, which decreases your resistance. So once your cells are no longer resistant, you can start to lose weight. This improvement in insulin and leptin sensitivity and resulting weight loss then lowers your testosterone production, which decreases your hirsutism and acne, and often balances out your estrogen and progesterone. So then you ovulate and have regular periods. It's pretty awesome. So my Omega Lift is a great way to get your EPA, DHA needs. I would say in general, most people need about 1 capsule a day, but if you have PCOS, I recommend 2 capsules daily or even 2 capsules twice daily, depending on how much inflammation you have going on in your body and what else is going on with you particularly, right? And this is a really important thing to note. Like, you want to make sure you're taking a high quality supplement that's been third-party tested and make sure there's no contaminants, especially omega-3s. They can be contaminated with heavy metals like mercury from fish. So my Omega Lift is sourced from waters off the Chilean coast. As the world's least industrialized coastline, these cold, fresh waters provide the cleanest, most sustainable source of fish in the world. So I'm confident recommending my Omega Lift to you. And I can't say that about most of the omega-3 supplements. So I just want you to know that. So number 4 is vitamin D3. So many of us are deficient in vitamin D. Where I live in Michigan, it's super common to see blood levels as low as, 15, 20, maybe 30. Optimal levels are like 60 to 80. So vitamin D deficiency exacerbates many conditions, and PCOS is definitely one of them. Not only does it contribute to PCOS, but the lower your D level, the worse your symptoms seem to be. Vitamin D is needed for blood sugar control, which is the main driver of PCOS, like we've been talking about. So supplementing with vitamin D improves ovarian reserves, seen with higher AMH levels and overall better fertility. So even if you aren't deficient in vitamin D, these improvements in PCOS have been seen. So I would say get your levels tested. If you're above 50, then you probably only need 2,000 IUs a day to get this benefit for this PCOS. If your levels are between 30 and 50, you need at least 5,000 IUs daily. And if your level's less than 30, you probably could use up to 10,000 IUs a day. I would recommend rechecking your blood, your vitamin D level in your blood in 3 to 4 months just to see your response, because you don't want your levels to get too high. But that would be my generalized recommendation. So you need to speak to your doctor specifically about what exactly is a good dose for you. But in general, the studies show taking at least 2,000 IUs a day has been beneficial. And I love my D3K2 Lift because it's a tasteless liquid. You just drop like 2 to 10 drops in your mouth and you're good to go, because it gets absorbed right in your bloodstream. It's a full dose. You're not relying on your gut for absorption. So this is fabulous. Everybody needs vitamin D. And we've come to learn that through the pandemic, right? Okay, number 5, NAC. N-Acetylcysteine is naturally made in our bodies and gets converted into glutathione, our major antioxidant that goes around and cleans house. It removes old and damaged cells and DNA, so those cells don't go rogue and grow into tumors, right? But you can take NAC. You can supplement this antioxidant in your body. And studies have shown that NAC improves insulin resistance, it reduces testosterone levels, and therefore causes less hirsutism in PCOS. So in one study, NAC was actually comparable to metformin, the diabetes drug that's often given for PCOS. So NAC was comparable to that in lowering insulin and androgens and improving your menstrual cycles. So that's pretty awesome, because a lot of women don't tolerate metformin, like I mentioned, because of the GI upset, the loose stools, the gas, the bloating, the diarrhea, the nausea. So I recommend you take like 600 milligrams of NAC 3 times a day. Do this for at least 6 months and you're going to see some major improvements. And why not do that, right? That's a no-brainer as compared to taking metformin. And last but not least, number 6, saw palmetto. Saw palmetto is an herb with strong anti-androgen abilities, meaning it reduces testosterone levels. High testosterone is what causes the hirsutism and acne and PCOS. So with that in mind, I created Beauty Lift. It's an awesome supplement. It's got saw palmetto and stinging nettle to decrease your testosterone and dihydrotestosterone production, but it also has biotin and vitamin A, which are super necessary for healthy skin and hair. So I love Beauty Lift for combating the physical manifestations of PCOS.